Hello everybody, I'm Karla. I'm gonna be doing my presentation on the importance of vaccinations. Here are my audience members. Say hello everyone.
Hello.
The purpose of my presentation is to provide education to my audience on the importance of vaccinations, how they are essential in protecting personal and public health and preventing the spread of dangerous diseases. So let's imagine living in a world without vaccines. Diseases like measles, polio, and whooping cough could all return. Hospitals would be overwhelmed with all these preventable diseases, working nonstop to help everybody, heal. Vaccines are not just a personal choice, but a community responsibility. I myself, as a nurse, have seen firsthand how patients suffer from diseases that could be prevented. We're not going to go that far. We're going to go to COVID 2020. When everybody was getting sick, we didn't have a vaccine. We were trying to help everybody who was getting sick. We were all overwhelmed. The vaccine came out. A lot of people were thinking, does it help? Does it not help? A lot of people didn't get it. A lot of people still don't believe in it. Regardless what the case may be, we still educate everybody on the importance of getting the vaccine to try and prevent from getting sick and possibly, death. This shows, vaccines are important, so let's analyze the problem. Misinformation and fear lower vaccination rates according to CDC 2022. The fear could be, side effects from the vaccine, fear of needles, fear of, the injection itself, whatever the case may be. We as healthcare providers always try to educate and present risks and benefits. Outbreaks occur in communities with low coverage, and vulnerable populations are at higher risks. Hospitals do experience increased revenue and healthcare costs during these outbreaks. The vulnerable populations, such as our infants, elderly, and immunocompromised people, are the ones who suffer. They're at greater risk when others refuse to be vaccinated. Vaccines, are required for school when we're young, at young age, starting, before we get to kindergarten, even preschool, and throughout elementary and junior high and high school. I myself work alongside with our infectious preventionist nurse at the facility I work at. So whenever we have a new patient come in, we always advise them on getting firsthand COVID vaccine, flu vaccine during flu season like we are right now, pneumonia vaccine, and the RSV vaccine. The elderly community that I work with are at higher risk, being that they're the ones that live there and we come in and out, so we also educate ourselves on getting those vaccines as well. Some elderly are tempted as to not get it, and so we provide education. Those who do refuse. A few days later, they change their mind and they say, hey, I want the vaccine after all, and we provide it to them alongside with written information on the importance of vaccines as well. Now that we understand the problem, we can discuss the solution. The solution being vaccines are safe and effective according to WHO 2022. As we see here, cases back then, whooping cough was at a high number of 17,777. It decreased by 87%, with cases now being 2,340. Mumps was at a high number, 36,101 cases, dropped by 98% to 737 cases. Measles, 53,584, more than 99% decrease in that, being now with 37 cases. Diphtheria, high number of 8,142, more than 99% drop in that with 5 cases. Rubella, 14,974 cases then, now only 1 case. So vaccines do reduce disease incidence by 90 to 99%. Education is very important, so we must educate ourselves, our community, to stay up to date with all our vaccines. The safety and effectiveness of vaccines have been scientifically proven. Studies show that. Nurses and healthcare professionals must guide patients in understanding the importance, the risks, the benefits of safety of vaccines. Vaccination safeguards family, friends, and communities. And again, healthcare professionals can guide and educate all of us. Let's picture the difference. High vaccinations, herd immunity, and fewer outbreaks. Low vaccination, preventable diseases do return. Children and elderly at risk if community coverage drops. Everyone must opt for vaccination. So let's all just schedule our vaccinations, encourage each other, encourage your family, your friends, your coworkers to make their appointments, get vaccinated. You can go to Walgreens, CVS, Walmart if you don't have a specific healthcare professional you go to. You can share reliable information from CDC and WHO to your friends, family. If they're not convinced to get vaccinated, participate in vaccination campaigns to get more information on vaccines. Vaccines is a shield for everybody, everyone, family, friends. It's not just medication. It's a shield to protect us all from all these preventable diseases. Vaccine saves lives and prevents suffering. Community health depends on personal responsibility, and your choice matters. Our choice matters. Everyone's choice matters. So I'd like to thank everybody for your attention, and I hope we all take away good information on vaccinations. Thank you.